So I'm from Alcoa, Tennessee. I started coming here when I was 2. I believe UT was the only option, and my parents, trusted it with it being a university and teaching. I think more so with the cochlear implants. I was actually a candidate 11 years before I got it, and I never felt pushed to do it. It was, an encouragement more than anything, but it was, it's your decision. With my daughter, she was 2.5 whenever I got implanted, and I knew she could hear. I knew she obviously talked pretty well at that point, but, toddlers were always hard. Like, even now, I can understand them, but, I still feel like they're kind of difficult, but I could actually, hear her voices, clearly and, her words, so that was neat, so.
One of the things that makes our clinic unique is just the breadth of services that we offer. So a lot of audiology clinics are focused mostly on, hearing and hearing aids, maybe even pediatrics as well, but ours is very unique in that we of course offer all of those services, but we have a very wide variety of specialty services, vestibular services, tinnitus services, auditory processing, auditory electrophysiology, cochlear implants, several that are there. And so I think it brings a lot to the education side, so our students get exposure to all of these things, but it's also a big service to the community because a lot of those services are very needed.
I chose audiology because growing up, my grandfather had Meniere's disease, so I was kind of into the appointments at an early age, and I became really interested in that. And then I also come from a music background, so getting both of those sides is what made me get into audiology. I've had patients where they'll say they're not going out to dinner anymore, they're isolating themselves, and then they'll come back even after a month of having a hearing aid and they're able to do those things with their families and go out and go to events, and they're just more comfortable being unisolated anymore. It makes me feel like I picked the right profession, I'm here for a reason.
In early intervention services, the therapy is centered around coaching the caregiver. And so we spend a lot of time talking with the parents and giving them opportunities to practice the strategies that we're using in the set and teaching them during the session so that they can go home and use that in their everyday lives. The elementary school population, I think they're so fun and have so much to say and do and are so interested in just random things. And I think I had such a great experience at school, and I want to help other kids have a good experience at school too.
I have a little girl that I worked with years ago when I first started working here, and she was 2 at the time. She had 1 cochlear implant. She is now a social worker. She has her master's in social work. Being able to watch her go through school, go through college, and is now a healthcare professional, that's really cool to get to see the progress. You have a lot of stories like that.
I do feel really, really proud about the amount of students that have learned here under our guidance that are out there practicing and doing these things for communities across the country. To me, that's the biggest part of it. I love doing research. I love seeing patients. But I came to this job with the reason because I wanted to help educate students. And so doing that and knowing that they're out there, and I've hopefully made a good mark somewhere along the way, for sure. That's definitely the most proud. Yeah.